The chair recognizes the gentleman from Michigan, Mr. Levin, for 5 minutes.
Thank you, Mr. Speaker. I rise today because the coronavirus is winning. 2.5 million U.S. cases, more than 126,000 Americans dead. That's more than double the number of American lives lost during the Korean War, tens of thousands more than the two-decade Vietnam War, and 10,000 more than World War I. The United States has 4.25% of the world's population, but 25% of the COVID-19 deaths. Tens of millions of Americans have lost their jobs or faced pay cuts. And in the coming weeks, economic lifelines passed by Congress that have cushioned the blows are going to expire. It does not have to be this way. Right now, as I speak, the Senate is sitting on the HEROES Act, a bill that Majority Leader McConnell has refused to consider for more than 45 days. What could have been done in those 45 days? Moody's Analytics said, and I quote, "If quickly passed into law, the HEROES Act would provide a substantial boost to the economy during the second half of this year, when the economy is most vulnerable to the pandemic and at most risk of sliding into recession. The legislation would also return the economy to full employment much more quickly," end quote. Moody's also said, "How well the economy does in the next several years depends critically on what lawmakers decide to do in the next few weeks." That was more than a week ago, yet the Senate still refuses to pass a bill that puts money in the pockets of workers with a second round of direct payments to families. A bill with new payroll protection measures to keep 60 million workers connected with their jobs. A bill that extends weekly $600 federal unemployment benefits through next January so families can pay their bills. But HEROES isn't just a bill to provide relief from the pandemic. It's a bill to end it. HEROES contains $75 billion for more COVID-19 testing and contact tracing, and $500 million to help our workforce system place new contact tracers, focusing specifically on Americans who are out of work and drawing from the communities they'll work in with the diversity reflecting those unique communities and the language competencies necessary to serve them. This last part is so important and a core piece of my Coronavirus Containment Corps Act, my bill with Senator Warren, that is included in HEROES in substantial part. Last week, Dr. Fauci said that U.S. contact tracing isn't going well. Why? Well, Dr. Redfield, the CDC director, says that we have 27 or 28,000 contact tracers when we need, in his own estimation, 100,000, and when other experts believe we may need double that. We have public health departments that are underfunded. We have communities that, after decades of discrimination, are understandably wary of trusting health authorities. The Coronavirus Containment Corps Act addresses every one of those issues. We have solutions ready. No single one of the solutions is a cure-all, but together they can turn the tide of this pandemic. We, as members of this body, are in a unique and privileged position to develop solutions that channel the resources we need to implement those solutions on a nationwide scale. To fail to do this is to accept the status quo. Let's make the HEROES Act law. There's not a minute to waste. Mr. Speaker, I yield back.